Hi, my name is Kristine Tatosyan-Jones. I'm a family medicine physician here at Vanderbilt University Medical Center. My primary role is as a primary care physician. I also do some work in teaching in our Center for Professional Health. Vanderbilt has that center primarily to protect uh, healthcare providers, physicians, nurses, nurse practitioners, PAs, so that we are protected, and the center empowers clinicians to do their work the best way they can do it and provides a lot of support. I'm also part of the Armenian Medical Society as a physician. Thank you so much for joining my talk today. Today we're going to I'm going to talk about empowering healthcare providers. Um, and the talk is mainly going to be about tools that we can use to empower ourselves to be the best that we can be. Um, Thank you again for joining us. So this talk is going to provide one CME credit and one CDE credit. And please be sure to pay careful attention, because towards the end, there will be a secret code that you will need to provide to get credit. And the secret code is the word empowerment. I have no financial disclosures for this presentation. So goals of this presentation. The purpose of this session is to explore the healthy boundaries that we healthcare providers can establish to protect ourselves and our profession. So many of us work in settings closely with patients, with nurses, with staff, with administration, and many of us can relate to the fact that we weren't really taught how to protect ourselves as healthcare providers. I've been practicing for about 14 years. None of this information is taught in medical schools. The primary focus of medical education is to be, to um, uh, give us skills how to be physicians, nurse practitioners, dentists, and other clinicians. But rarely are we taught skills on how to protect ourselves and empower ourselves in our field. The objectives will be that the participants completing the session will be equipped with tools to set healthy boundaries with 1, patients, 2, nurses and staff, and C, organizational administration and leadership. The agenda today. So first, introduction and importance. 2, we're going to talk about the healthy boundaries. And 3rd, we'll end with summary. We're going to start with a case discussion. I think it nicely illustrates the concepts that I'm trying to teach in a real way. So I'm going to go ahead and read this discussion. So a patient arrives for his physical and is roomed by the nurse. It is an exceptionally challenging day for Dr. M, who has had a complicated patient prior to seeing this patient and is running about 40 minutes behind. When Dr. M enters the room, the patient stands up and is irate. In an irate voice, he voices his discontent with the wait. He goes on to let you know that he has been waiting for this appointment for months, and this is a disrespect for his time. Many of us can relate to the situation, especially the primary care physicians. We often work in settings where we're seeing 20, in some settings, even 30 patients a day. So it's not uncommon for healthcare settings to have patients that are impatient and they've been waiting for a while, and you walk in and you've got a patient that's, angry or frustrated and may voice this. So how do you handle a situation like this? Well, this actually is a real patient that happened to me when I was practicing. This is considered disruptive patient behavior, because what's happening here is the patient is being rude. and that can impact our clinical judgment. So key concepts on how to handle this. Um, we talk about professional healthcare provider behavior. However, there's also something called professional patient behavior. You know, the organization expects us, healthcare providers, to be professional, to be kind, to be empathetic, to listen well. But the organization sometimes doesn't, hold patients accountable. And it is okay for healthcare providers to keep the patients accountable to professional patient behavior as well. Why is this important? So the key concept here is when you have a patient whose behavior is disruptive, it can affect the safety of the care. How many of you have been in a setting where a patient has been rude and you almost feel like your heart rate going up, you're getting irritated, it's harder to concentrate. So because of that, to protect ourselves, it's really important to set the healthy boundaries. De-escalation of conflict, of course, is important. When you have a patient that's angry or disrespectful, the key here is to pause and let the patient express their emotions and their feelings. Obviously, there's boundaries. If the patient is expressing their frustration in a relatively respectful way, it's okay to let the patient vent, so to speak. And with de-escalation, it's important to validate their feelings that, I understand, Mr. So-and-so, you're getting increasingly impatient. I can understand your anger and frustration in this situation. I understand you've been waiting for a long time. So that's the validation piece. However, the key here is to also communicate to the patient that it is in their best interest to be respectful and patient and kind towards you as a healthcare provider. Because why is it in their best interest? Because by doing that, they're going to give you the space and the ability to provide the best care for them. So often I've done this with patients in my practice where if I have a rude patient, I'll literally pull up my workflow and I'll show them, I'll say, I'm doing my best and I know I was late for this appointment here, but the reason I'm late is prior to you, maybe there was a challenging patient or a challenging situation that I had to take care of. And I explained to them that the care I'm providing, I have to do it in a safe manner, and I have to take my time sometimes, and it does require a wait. And I also have set a boundary where I've said, when you're speaking to me in a disrespectful tone like this, it has the potential to affect my decision making. And that's the key here, my decision making. So when a patient is rude or disrespectful, it can negatively affect the provider's decision-making ability. And that is why it's important for patients to understand that there's also professional patient behavior that we can keep them accountable to. How do we utilize organizational resources to support us with disruptive patients? So the key here is to really understand the way your organization is structured. So is there a department, is there someone in charge that takes care of disruptive patients? That's very important. For our organization at Vanderbilt, we do have patient relations, and patient relations primarily is for patients to voice their discontent with doctors or healthcare providers that they're not happy with. However, what we've been doing is it's a two-way street. We also use the patient relations to report any disrespectful, disruptive patients. And the case here to make when you're trying to let go of a patient is that this patient, their behavior is adversely affecting my clinical decision-making skills, and it's compromising the safety of the care that I can provide for this patient. There's very little to argue for an organization in this case, because truly, if a patient is so disruptive that they're compromising the safety of the care that you can provide, because they're compromising your ability for clear judgment, it's the case is made that that patient will be moved either out of the whole organization or maybe to another physician or clinician. When to let go. This is an important concept. So I got very used to saying the words, Miss So-and-so, I'm doing my absolute best to take care of you. But if my best is not good enough for you, I may not be the right physician for you, and I will not be offended if you find another doctor. We healthcare providers are not always the best match for every patient out there. There are sometimes patients that I may not be their best doctor. I may not be the best fit for them, and that is okay. And I think that's that piece of letting go of our wanting to, you know, be that best provider for everybody. We can't. Sometimes it's just not the right match, and it's okay to let go. And it's important to understand when to speak up to let that patient go. And I've said this sentence a few times, and normally what I find is patients respect that. You know, they there's a humility in that statement where you're saying, "I'm not God. I may not have all the answers, and I just may not be the right fit for you. And it's totally fine if you want to find another healthcare provider that's going to be a better fit for you. That's actually a healthy thing to do, and it protects you, and it protects the patient because maybe they're better off with someone else. So conflict. Dr. Charlene Dewey is one of the assistant deans at Vanderbilt here, University. And this is a quote. It's conflict happens when one person says, I expect this, and the other person says, I expect that. And they're usually in direct conflict with one another. So it's really important to recognize conflict. And sometimes the solution is just to simply go separate ways if there's no resolution of that. Often what I see with disruptive patients or with patients that there's conflict with, if I reach out to patient relations and report them, patient relations will try to navigate this, will reach out to them, try to establish healthy boundaries and say, this is what we expect you to behave like when you come to the office. This is really important for our organization. It's to protect you, it's to protect your physician so that it's a safe environment for everybody involved. And normally, commonly patients will adjust their behavior, and next time they come in, they're much better. But sometimes we just have a challenging patient that they're not understanding that point across, and we just let them go. I've had patients where we've discharged them from the entire Vanderbilt system because they weren't able to interact with us in a professional manner. Next, we're moving on to boundaries, healthy boundaries with nurses and staff. So this section is about discussing healthy boundaries that we healthcare providers must have with our nurses we work with our staff we work with, because again, this is something really important to protect ourselves. So here's a case presentation. So Dr. B is an excellent primary care physician who likes to be on time with her patients. She's assigned to be working with a nurse who is habitually late, and this results in disruptions in care because her patients are routinely delayed in being groomed and ready for her to see her. Dr. B has had a few brief discussions with her nurse, asking her to be prompt on time, but this is not working. She's getting more and more frustrated and short with her nurse. So many of you can recognize this scenario. We healthcare providers often can have conflict with our nursing staff, with just generally staff that's working in the office. And how do we handle these situations? One of the most important key concepts is to really understand the role that we healthcare providers have in relation to nurse management and office staff. Okay, so when I first started this profession years ago, I had the erroneous thought and idea that it was my job to manage my nurse. Okay, so if she made an error or if something wasn't working, it was my job to sit down, educate my nurse, and try to figure things out. I learned that that's actually wrong. So it's really important to understand that our role as healthcare providers and physicians is not to manage the nurses. Okay, and if you try to do that, you can get into some deep waters that can get you in trouble. Okay, how many times have we heard the story that there was conflict between a doctor or resident and a nurse, and usually resulted in something negative? So this concept is key. So who manages our nurses and staff? Well, every office, every medical office has an office manager, and that's truly their job to manage the nursing staff. So in this case scenario, going back, so here's a physician who's working with a nurse, and she's had a few brief discussions trying to come to an understanding with her nurse that it's really important for the nurse to be prompt because it can affect the safety of the care. But this nurse is not following through with that request. So the best thing to do in this situation is to involve the office manager. Because when you have this conflict just with a nurse without the involvement, it's he said, she said. So, I mean, there have been numerous cases reported where a nurse will go and say, the physician reprimanded me, was rude to me, and this has resulted sometimes in termination of a clinician or a healthcare provider. So the best way to manage these situations is talk to your office manager and document a trail with emails, because that way there's documentation. And if you're noticing a pattern, especially, document the pattern, document, and then request a meeting with your office manager and the nurse, where the office manager will be the mediator, the liaison, so to speak, to mediate that conflict. And it's their job, it's their role to manage the nurse. Okay. And therefore, that brings me to point B, that it's really important to foster healthy relationships with your office manager and lead nurse, because that's the go-to person that you're going to be working to manage your nursing staff and to really understand roles here. Next, we're going to move on to our third topic area, and this is how do we create healthy boundaries as healthcare professionals with administration and leadership. This is an especially sore subject for many of us because, as you can understand, many times there is a conflict of interest between administration, leadership, and healthcare providers. And this is not taught anywhere. Physicians will tell you none of this is taught in medical school. It's not taught in residency. Many of us learn these lessons the hard way when we make mistakes. Or if you're smart, you learn it from a colleague who's made mistakes. So here's a case discussion that we can go over. Dr. K is a new PCP out of residency who just got married and has a 6-month-old infant at home. She has been working part-time and juggling work and home responsibilities, trying to optimize her wellness. At a staff meeting, the office manager announces that the organization is going to standardize physician templates, and physicians will be expected to work more hours due to the new standards. Dr. K becomes increasingly anxious about this announcement and the changes it may bring to her work and life balance. So, work life balance is key in our profession, and it is absolutely critical to understand how to foster a healthy work life balance. Years ago, when I first started, the sentiment everywhere in our training, in starting even from medical school, the sentiment was patients come first. We're starting to really change that dynamic and change that concept with wellness, that patients do not come first. Okay? The healthcare providers come first. And at first, this is kind of sounds almost disturbing. Like, what do you mean your patients are not important? But when you really dig deep into this concept, it's that if the healthcare professional is not well, it's going to affect the care that they provide for that patient. It's kind of like the same concept with a plane, right? When you have a big plane with 300 passengers, who is the most important person on that plane? Whose well being is most important to the survival of that plane? The pilot, right? So, this is the same concept with looking at wellness and protecting ourselves as healthcare professionals. So we no longer try to promote this, that our patients come first. Patients do not come first. We come first. Because guess what? If you're well, if you're happy, if you're healthy, if you have a good work balance, you're going to do a better job for that patient, and everybody is going to be better off. So in this scenario, Dr. K is trying to work part-time. She has a little 6-month-old at home, and she's trying to have a work-life balance. But all of a sudden, the organization, so this is probably from upper leadership, there's communication coming in that now we're going to standardize templates, and we're going to require physicians to work more hours. And this is a common scenario we find in so many settings. I mean, there's stories after stories that I've heard of healthcare providers or healthcare professionals going through this very same thing. So how do we navigate this? How do we protect ourselves when we are confronted with conflict with administration and leadership? When when there's a conflict of interest, you as a healthcare provider, if you work more, you're going to make more money for the organization. They're in conflict with you because the less you work, the less money they're going to make. So how do we navigate this? So again, setting healthy boundaries with leadership and administration. Key concepts. So know yourself. This is so important because this is the primary place where we start. Years ago, when I started first practicing medicine about 13, 14 years ago, I thought, full-time work, what's the big deal? You just work 30, 40 hours a week and you're fine. I quickly learned that that was not the right setting for me. I ended up getting burned out after about 5 years. It was just not sustainable. So knowing yourself and what your limits are and what makes you happy, what's that key balance that makes you feel fulfilled. And the key here is when you leave your work and you go home, do you have energy to live the rest of your day? Or are you so drained that when you go home, there's nothing left? So this is where knowing yourself and understanding what are you passionate about, what fills your tank, what kind of work fills your tank. Do you like doing more research? Do you like seeing more patients? Do you like maybe you like more administrative work? But it's really digging deep and understanding what gives you joy. And when you find what gives you joy within your work, that's when things really start making sense. And what happens is when you work in that manner, work becomes sort of like almost like play because you're enjoying what you're doing. You're not draining yourself. Um, Years ago, I realized that research was not something that I enjoyed. My primary passion is seeing patients. I love seeing patients. It gives me so much joy and fulfillment. When I get home, my heart, when I come to the office, my heart is full. When I leave the office, my heart is even fuller. And I don't feel drained. I feel like I have the rest of my day to enjoy my day. And when I get home, I have more to give to myself and my family and live. Okay. Um, so it's really important also to establish healthy priorities and to know your priorities. You know, in medicine, it's difficult. In medicine and healthcare fields in general, it's very difficult because it takes a lot of work, and for years and years we have to prioritize our studies and our school and our training to get to where we are. And it's easy to stay in that habit because once we finish our training, um, many of us continue prioritizing the work as a number one priority. But understanding the importance of establishing healthy priorities can really help us um, live a more fulfilling life. So, how to approach leadership? Okay, this is another concept. The art of negotiation. There's been many books written on the art of negotiation and how to approach leadership. So, in this case that we had with this doctor who hears the message that now she may be required to work full time, perhaps, and she becomes increasingly anxious about this announcement. What next steps can she take? Okay, this is where careful thought process, decision making, and pause is really important. Um, this is actually a real scenario that ended with a positive outcome. So often when we hear something that makes us anxious, the um, impulse is to respond. But the challenge is to pause. You know, when you get that email or you see that announcement, if you find yourself getting triggered by it in any way, it's creating like this internal intensity. It's best to just say nothing. Say nothing, pause, and just give it some time. Those of you that are faith based, we say pray on it or sleep on it, think on it, but just give it some time, give it some space, and then come back to it later. In this scenario, what ended up happening was this physician asked for um, in-person meeting with the office manager and the chief medical officer. And what happened is in this meeting, she went in with an agenda. And on top of the agenda, the number one point on the agenda was personal wellness. And she was able to, in a very thoughtful way, to make a case that she would not be willing to negotiate more hours. So, it's this is that piece where you have to know what your non-negotiables are. So when you go into a negotiation, you need to know when you have to walk, and you have to be ready to walk. And this is where this physician won this case, because she went in and she said, I'm willing to give this much. More than that, I'm not willing to compromise on. So standing your ground, knowing yourself, knowing your limits, knowing what makes you happy and what makes you fulfilled, and then knowing that what your non-negotiables are. You know, for some of us, non-negotiable is not working more than 20 hours a week. That could be your non-negotiable, because maybe you prioritize other things, and our work is important, but at the end of the day, we have a life to live. So it takes a little bit of courage here, but it's work and thought that is well worth it. This type of journey of knowing yourself and knowing what your priorities are, if you have any higher power spirituality in your life, this can really guide you on this journey, because it's hard to do this alone. Okay, so healthy priorities. This is just an example of understanding healthy priorities. Like I mentioned before, for so many of us that have been through rigorous training in medical school and residency and training, you know, often our first priority was work, and it had to be that for us to succeed and to get to where we were. But, you know, as we walk through this journey, we recognize that it doesn't always have to be that way. Okay. And the healthier priorities, if they're set this way, it actually leads to a more fulfilling life and career. So this is just one example. It doesn't have to be, you know, it's not for everybody, but this is a healthier priority list than having work as your number one priority. So number one, priority could be the higher power. For some people, that's God. For some people, that's spirituality. For some people, it's nature or universe or whatever you call it. For some of us, you know, sitting by a brook and hearing the water gives us spirituality. For others, it's going to church and serving. And then number two is self, right? After prioritizing your higher power, could be self. Then it could be the nuclear family. Then it could be hobbies and interests. Then it could be exercise. Then it could be your extended family. Notice that work on this example of healthy priorities is like way down, you know. But ironically, interestingly, what happens is when we prioritize well and we prioritize in a healthy way, we become the best self, the best version of ourselves, that we're actually we're able to do the best job we can for our patients, and we're able to prioritize our patients because we're taking care of ourselves. So pursuit of happiness, key concepts: dare to dream for your legacy and calling and following your joy. The more you spend time learning what gives you joy and fulfillment, the more likely not only are you going to be on the right path, but also have a fulfilling life. And B, living a day at a time, being connected to the higher power to guide us on this journey. And finally, learning healthy boundaries to protect ourselves and prioritize ourselves. I'm hoping that this gives us a little bit of insight into how to set healthy boundaries, both in all areas, you know, with our patients, with our staff and nurses, and with administration. Summary. So in this session, we learned how to establish healthy boundaries with patients, and this can create a safe work environment for ourselves, our nurses, staff, and patients. Again, many of you work in healthcare organizations and where you may not have seen what professional patient behavior looks like. But what I want to let you know is that um, we are not the only ones accountable for professional behavior. Patients are held to that accountability too. Now, of course, there are certain exceptions to this. We have a lot of grace for patients, for example, with mental illness, right? Years ago, I had a patient who had schizophrenia. I'm not going to expect that patient to, if they're upset or mad or screaming, I will have obviously more grace for that patient. But there are limits. There are limits. We don't come to work to be abused by anybody, and knowing how to establish those healthy boundaries to protect ourselves is key, so that everyone feels safe. In our office, we have little signs and it says everyone is stretched, be kind. So having a culture in the organization can be key, but it takes individuals to create the culture. So for me personally, if a patient is rude to my nurse, if a patient is rude to my receptionist, that is not okay. We are a team, and I'll speak up for my nurses, for my receptionists, because I make sure to set those healthy boundaries with the patient that it's not okay to do that to my team, because everybody is involved in the care. And to provide safe care, we expect the patients to also be professional. Number two, healthy boundaries with nurses and staff can protect us professionally and personally. So here we learned to really understand our role as healthcare professionals, and to really understand that our role is not to manage the nursing staff. Okay. You want to have good relationships with them. And the trick here is that I've often heard physicians say, well, if you go and talk to the office manager about an issue, then your nurse is not going to trust you. This isn't about trust. It's about building a team. So often it's the way that we communicate with the nurses. So I'll let the nurse know, I want to make sure that we do this the right way. And often we'll have monthly meetings with my nurse, with my office manager, to keep working to improve processes. So it becomes almost like second nature. So it doesn't feel like I'm going behind a nurse's back and telling on them. Okay, it feels more of a team approach. My nurse is on my team, but my team is also the office manager, whose job is to be a liaison with all of us. So it's a healthy environment, and I don't have to feel like I have to manage that nurse, and it's my word against the nurse. We have a liaison that fosters that relationship in a healthy way, moving us forward. And finally, the third topic that we talked about was setting healthy boundaries with administration and leadership, and learning to speak up for ourselves. This can help us prioritize our needs and optimize our work and life. It can lead to a more fulfilling life legacy. This is key. I think, through our training, nobody teaches us how to protect us from leadership. We often look up to leadership, and we're often taught to simply follow what leadership says. And it's important to follow rules, but it's also important to understand yourself and set healthy boundaries and speak up your needs. You may not be the right fit for every organization. And the trick here is to find an organization that aligns well with your value system. If you're working with an organization that does not prioritize wellness and will do everything at your expense and not care about your well-being, and that doesn't align with your values, and if you recognize that, it's easy to walk away, but then search and find an organization that values you as a human being. In leadership, there's often the word standardization. The key concept here is I don't believe in standardizing any of this, because healthcare providers, we're not standardized beings. We're human beings. And each of us is created unique with our unique gifts, strengths, and weaknesses. So standardization may work for AI or robots. It doesn't work with people. So it's our job to speak up, and when things are trying to be being standardized, to speak up and say, this will not work. This may work, and to learn how to negotiate and come to an understanding. We also teach conflict management courses at Vanderbilt, and some of this is in debt with goes into depth with conflict management, but the basic idea is don't simply follow what leadership and administration wants you to do, but also you don't want to do it in a way that is confrontational and creates animosity. This is the approach with conflict management. You have to try to find win-win situations. So often when you're trying to make the case of what's best for you, the smartest way to do that is to also make the case that what's best for me is also going to be what's best for the organization and the patient. Because if I do things the way that make me happy, that give me joy, that give me purpose and fulfillment, I then am going to be the best version as a physician, as a dentist, as a pharmacist for the organization, and be able to give your organization my best. So it's a win-win collaborative approach and references. Thank you so much for joining me today, and thank you for taking the time to listen. Bye-bye.